Hi, it's Graeme De Goldi, the Director of the Melbourne Institute of Massage Therapy. Today I'm going to be talking to Rob Granter about his presentation on the cervical spine. Our Soft Tissue Therapy Congress is on October the 26th. That's a Sunday. We're starting at 9 a.m. Rob did a great presentation last year on the shoulder, and I wanted to talk to him about what he's actually going to be talking about at the Congress, and some of the things we might be able to expect from that presentation. Rob, from the cervical spine in. Sounds interesting.
Thanks, Graeme. Yeah, I chose the topic of the cervical spine from the outside in because it makes really good sense from the point of view of learning and retaining our anatomy and doing a thorough assessment of the cervical spine, and from a treatment perspective to start from the outside and work our way deeper. So looking at the anatomy, it makes good sense to make sure that we learn the key surface anatomical points, and we try and get very referenced in terms of our knowledge from those points and get a solid understanding of the outside layers before we even attempt to start going deeper. So it just allows us to have a good system to retain that knowledge. Treatment-wise as well, it makes good sense to look at the outside forces, the postural forces, the gross movements of the neck, and then, where appropriate, start looking at the more segmental, the deeper segmental function of the cervical spine. So again, we're going from the outside to a deeper layer.
Yeah.
And from treatment perspective too, somebody walks in and they've got neck pain through here. Well, it makes no sense for us to stick our finger in that, one sense. We want to make sure that our outer layers are functioning optimally, and they're appropriately. Then, where appropriate, we start working then deeper and deeper and resolving issues in a more structured, layered approach. So we're starting from the outside and working our way in.
That's a really good way to look at it. I think as practitioners, particularly if you're a home-based practitioner or a sole practitioner, you get so used just to doing your hands-on that getting to events like this is really important, because you do get to review the anatomy, and Carl Ridgway also spoke about the anatomy, the importance of knowing your anatomy. I assume there's going to be some practical demonstration.
We'll certainly have, if we've got time to do the practical demonstration, there'll certainly be plenty of video demonstrations embedded in the PowerPoint presentation, so there'll be a very practical component to the whole presentation. Yeah. It shouldn't sound too dry. It's my job to make it fun and enjoyable.
It'll be fun.
And we'll have a good time. It'll be hopefully very productive in terms of a learning situation.
And anyone that was at last year's Soft Tissue Congress will understand how much it really was enjoyable seeing the video of the shoulder. That was sensational, and seeing the bursa and all that, diagnosis and all that sort of stuff. That was great, and people really were commenting on how good that was. So we're going to expect pretty much the same, and we're going to know that everyone that's coming will get something really good out of this. There's still spaces available. As people know, Rob's an exceptional example to the industry, so it's great to have you there. If you want to know how to get on board, you can look at the slides that will follow this presentation. But Rob, thanks for coming on board. I know we're going to have a crackerjack day.
Fantastic. Thanks, Graeme.
Good on you.